Anatomy of ear, it's divided into three parts: external ear, middle ear, internal ear, or labyrinth. Internal ear, labyrinth. External ear consists three part: auricle or pinna, external acoustic canal, tympanic membrane. Auricle and pinna, the entire pinna except its lobule and the outer part of the external acoustic canal are made up of framework of single piece of yellow elastic cartilage covered with skin. The latter is closely adherent to the pericardium chondrium on its lateral surface, while it is slightly loose on the medial cranial surface. The various elevations and depressions seen on the lateral surface of the pinna shown figure 1.1b. There is no cartilage between the tragus and crus of the helix. This area is called incisura terminalis, figure 1.1c. An incision made in this area will not cut through the cartilage and is used for endural approach in surgery of the external auditory canal or mastoid. Pinna is also source of several graft materials for the surgeon: cartilage from the tragus, pericardium from the tragus, or concha fat from the lobule are frequently used for reconstructive surgery of the middle ear. The conchal cartilage has also been used to correct the depressed nasal bridge, while the composite graft of the skin and cartilage from the pinna are sometimes used for repair or defects of nasal ala. External acoustic auditory canal. It extends from the bottom of the concha to the tympanic membrane and measures about 24 mm along its posterior wall. It's not a straight tube. Its outer part is directed upwards, backwards, medially, while its inner part is directed downwards, forwards, medially. Therefore, to see the tympanic membrane, the pinna has to be pulled upwards, backwards, laterally, so as to bring two parts alignment. The canal divided two parts: cartilaginous and bony. Cartilaginous part, it forms 1/3 8 millimeter of the canal. Cartilage is a continuation of cartilage which forms the framework of the pinna. It has two deficiencies: fissures of Santorini, and in this part of the cartilage, the cartilage through them, the parotid and superficial mastoid infections can appear in the canal, vice versa. The skin covering the cartilaginous canal is thick and contains ceruminous pilosebaceous glands which secrete wax. Hair is only confined to the outer canal, and therefore funcus staphylococcal infection of hair follicles are seen only in the outer 1/3 of the canal. Bony part, it forms 2/3 16 mm skin lining. The bony canal is thin and continuous over the tympanic membrane. It is devoid of hair ceruminous glands about 6 mm lateral to tympanic membrane. The bony meatus presents a narrowing called isthmus. Foreign bodies lodged medial to the isthmus get impacted, are difficult to remove. Inferior part of the deep meatus beyond the isthmus presents a rhesus called enterorhesis, which acts as a cesspool for discharge and debris in cases of external and middle ear infection. Figure 1.2, antero-inferior part of the bony canal may present a deficiency for Raman of Husky. The children up to the age of 4 or sometimes in adults, permitting infection to and form the parotid. Tympanic membrane of the drumhead. It forms the partition between the external acoustic canal and the middle ear. It is obliquely set as a result. Its posterior-superior part is more lateral than its antero-inferior part. It is tympanic membrane of the drumhead. It is 9 to 10 millimeter tall, 8 to 9 millimeter wide, and 0.1 millimeter thick. Tympanic membrane can be divided into two parts: pars tensa, pars flaccida. Subnels membrane. It forms most of the pars tensa, most of the tympanic membrane. Its periphery is thickened to form a fibrocartilaginous ring called annulus tympanicus, which fits in the tympanic sulcus. The central part of pars tensa is tendent inwards at the level of the tip of malleus and is called umbo. A bright cone of light can be seen radiating from the tip of malleus to the periphery in the antero-inferior quadrant. Pars flaccida. Subnels membrane. This is situated above the lateral process of malleus between the notch of Rivinus and the antero-posterior malleal folds, earlier called malleolar folds. It is not so taut and may appear slightly pinkish. Various landmarks seen on the lateral surface of tympanic membrane are shown in figure 1.4. The ear, its division, and the elevation and depression of the lateral surface of pinna. Okay. Number A. Ear division. Ear. External ear, middle ear, and internal ear. Auricle. External acoustic canal cartilage. This one, auricle, external cartilage, and external acoustic canal cartilage. Tympanic membrane. Internal acoustic meatus, yellow color. Internal acoustic meatus. Pharynx. Pharynx start from end of the ear, internal ear. Pharyngotympanic tube. Auricle. And number B, the elevation and depression on the lateral surface of pinna. Triangular fossa, helix, samba conchae, antihelix, concha, lobule, crus of the helix, tragus. Number C, auricular cartilage, helix, spine of the helix, incisura terminalis, tragus, antitragus, tail of helix, concha. Anterior recess of the meatus. It is important to clean discharge and debris from this area. Anterior recess, external ear canal. Coronal section through tympanic membrane, external ear canals showing structure of pars tensa, pars flaccida of tympanic membrane. Scutum forms a part of lateral attic wall. Scutum, external canal, pars tensa, pars flaccida, annulus, tympanic membrane.